Welcome back. Cosmetic dentistry has come a long time in our lifetime. From whitening techniques to crown and veneers, our next guest puts into practice all of the latest technology. Here to help us achieve that smile that everyone will notice, Dr. Joel Stokes from Eastern Canyon Dental. Welcome back.
Good morning. Good to see you again.
Great to have you here. I love this. We're going to really see what you do today.
Absolutely. Usually we bring patients on, we do befores and afters, but people ask me, what is it? What do you really do?
Yes, what?
So we want to show a couple of the techniques that we use for cosmetic dentistry in our office. There's some other things that we do, and a lot of times we use these in combinations with one another, but these are some of the things that people talk about a lot.
Excellent. You wanted to start off by telling me about veneers.
Well, porcelain veneers have been around for quite a while. I've been doing them since 1984. I remember I took my first class at used to be the Hilton Hotel, and I finished this class. It was put on by a company
wow, that looks
out of Utah, and I said, my God, I've got it. So my first patient was my wife, you know.
Really?
Yeah, Sandy and I, we've been married for 43 years, and way back in '84, she had some cosmetic dentistry issues, and I really was reluctant to take and grind her teeth all the way down and put caps on her teeth.
Absolutely.
So I said, I've got it. So the next Monday after the class, Sandy came in and we put my first set of porcelain veneers, and that was back in '84. And I've changed them out once in all that time. That's a long run. I've had patients that have had these on for 25 years.
That's awesome.
But sometimes we have to change them because, you know, the gums recede and patients get older, things, you know, rarely chip.
For the most part, they really endure. We have some before and afters. We saw that beautiful woman before. Boy, it transforms the whole person when you fix this smile. These are veneers as well?
These are veneers. I can't mention this gentleman's name, but he's famous. And he came in and said, I don't like this. He was referred by a friend of his and a colleague, and we did some change in the architecture of the gum tissue with a laser. You know, this is a different case than we just showed before. But this lady came in. She says, I want veneers, and I said, no, not right now, because there's some other things that we have to do. So we worked with a periodontist. We trimmed the gum tissue. We actually removed some bone and gave some more length to the teeth, and then we put a set of porcelain veneers on. Life-changing. Amazing. I get goosebumps when I think about what that did for her.
By the way, is this a veneer right here?
This is a sample of a porcelain veneer. It's a high impact porcelain. It's made in the laboratory. I've got a beautiful lab in town here that does these by hand. A lot of times now they do them by computer generated, but our guy does them by hand. He stacks the porcelain by hand and does just a phenomenal job. And what happens is
beautiful color.
Yeah, we can make the color and the shape anything we want. We take the teeth and they're made, and then we can actually just bond them right over the natural teeth. That's kind of like a model. You can make them. I just did a fellow for one had a dark tooth, and we're doing one, but we can do them in ones or fours or sets of 10.
You know that the thing I love about talking to you, Dr. Stokes, is that, well, you really approach each client individually.
Right.
And you have years of experience, and so you understand that each person might have to go through a different process.
That's true.
You want to do it the right way.
Well, the first thing is that we make sure that people are healthy. If somebody comes into my office, we sit down for about 20, 30 minutes, and we connect. If we're going to connect as doctor and patient, that's what we do. That's the time I take before we do anything. Make sure we're on the same page regarding their care, working for the same goals. And that we determine that. And it's a little process that we go through, and anybody that would like to come in to go through that with me, sit down and find out if we're the right people.
Yep.
Come in, sit down for 20, 30 minutes. No obligation to do anything.
Beautiful.
Actually, what I'll do is I'll show you how to interview a dentist or a doctor. Take them through the same points.
Oh, wow. There's comedy involved in their visit as well. We need to move on because I don't want to leave out, there's a few things to talk about. The glow. What is the glow?
Glow is a technique of tooth whitening that has come about the last year. I really like it because it involves a tray. This is the tray that we use, and there's a gel that goes with it.
Is that a laser?
It's a LED light.
Oh, LED light.
So it doesn't create any heat.
Can I?
I wouldn't, you know, especially with that germ thing that you just talked about, you know.
That's right.
And after the dog and all that, it's hard to follow a warm, fuzzy little animal like that.
That's why you're here.
But what it is there's a gel. We do it in the office. This particular is like the high end on
oh wow, what a transformation!
On whitening with this technique. The patient actually gets this charging unit and the tray and some gel, and they can actually touch it up at home.
You do that at home.
You can do the first visits at the office. You take it at home. I have this is the only system that I know that can actually brighten existing porcelain.
Wow!
My wife uses it.
You can brighten your veneers with this.
It actually cleans them and brightens them. It's the only system that I know that can do that.
By the way, I need a little whitening. Wouldn't you say?
A little, but it's hard to improve on perfection.
Oh,
yeah.
Well.
Anyway, listen. Here's one other technique that we have.
Real quick, we've run out of time.
Okay, this is a snap-on smile. It's a lot of times it's an intermediary procedure in other things that we do. But for patients that can't tolerate a lot of dentistry, older patients that maybe have to come in a wheelchair or something, or if they need something really quick for a wedding, this is a really great way to go.
Temporary perfect teeth, folks. This is something else.
It just snaps in just like that.
Thank you, Dr. Stokes.
It's always great.
I'm going to read your special out there for Morning Blend viewers who might be watching. Take advantage of Dr. Stokes' special offer. The first 13 callers will receive a $100 gift card towards any service that they offer. And also, if you're interested in veneers, Dr. Stokes will give you a $250 gift card towards your veneers. Wow! Eastern Canyon Dental is located on Southeastern Avenue, just south of Wigwam. To learn more, visit their vegasdentist.com website or call the number listed. They are a proud sponsor of the Morning Blend.